Hi, my name is Cindy Rifenburg and I'm an occupational therapist. I work at Lehigh Carbon Community College in Schnecksville, Pennsylvania, and I'm going to share with you a couple of different videos about how to work with occupational therapy assistant fieldwork students. The first one we're going to talk about today is how to prepare objectives for fieldwork level 1 and level 2 students. I have some information here that I'll be looking towards back and forth, but I'll give you a big overview of what we'll be going towards. We'll be looking at fieldwork level 1 and level 2. So the first part, let's think about where we can get resources. The American Occupational Therapy Association has some fabulous resources online that you can access. You can also attend the Fieldwork Educator's course, which is available around the country. You can also attend different universities and colleges will offer Fieldwork Educator seminars that you can go to. And sometimes you can just resource and network with some of your fellow occupational therapists, either at your institution or in any of the facilities or clinicians. So, what do you need to do before you take on an occupational therapy assistant student for fieldwork level 2? How do you know how to prepare level 2 objectives? There's a couple of things that are really helpful. The first thing is to look over the job description for your particular facility regarding the role of a COTA. If you have that information, that gives you a real good baseline about what is considered the job responsibilities for an occupational therapy assistant. We also need to figure out what other skills are needed. Are there skills that an occupational therapy assistant does after they've been working at your facility for a period of time? Or are there things that are really entry-level skills? And that's important to try to decide before you identify what are we consider core skills. It's also important to clarify the role of the occupational therapist versus the occupational therapy assistant, as their roles are different and the expectations would also be different on fieldwork level 2. So, other things that are important is to decide what type of clinical decision making does the practitioner in your facility need, whether the practitioner is an occupational therapist or an occupational therapy assistant. What do I mean with that? Well, in some settings, being very quick with safety is going to be very important. In other settings, learning how to handle behavior and redirect impulsiveness or agitation is going to be much more important. In other settings, a clinician's ability to understand lab values or how to handle IV lines or even wound management might be a critical skill, but it may not be a critical skill in a different setting. So you really need to know what's expected in your particular setting. Once you've reviewed the critical job skills, in other words, what should an entry-level practitioner be able to do in your setting, you've also looked over what type of quick clinical reasoning skills you need. Then you can start to create your final core list of the expectations or the skills of an occupational therapist or an occupational therapy assistant. Before you go any further though, it's really important to share that with your fellow coworkers, because each therapist in every facility has a slightly different interpretation of a job description or what they might think is critical job skills. Once you've figured out what your core job skills are, you're going to want to compare those to the AOTA evaluation forms that are used for both occupational therapists and occupational therapy assistants. That evaluation tool is broken down into different categories, and you can decide where your core skills fit into those particular areas noted on the evaluation. From there, it's important to write measurable objectives. What does that mean? That means if you knew you needed your occupational therapy assistant to perform a certain type of skill, what does that look like? How much, or how frequently, I should say, will they need to do that? And you want to make sure that's written out in a measurable way, because that's what you're going to be comparing the student against, those measurable objectives. Once you've got that in place, it's kind of easy to work backwards from there. You know what the final destination is. You know what that occupational therapist or occupational therapy assistant needs to be able to do to be entry level. But remember, they're just starting an internship at your facility when they come to you for a level 2 fieldwork. So working backwards, what does halfway there look like? What does a student who's brand new just starting look like? And that helps you decide your measurable steps as you move along in the fieldwork process. Then again, share your draft of your behavioral objectives with the academic institution that you'll be accepting interns from. Each academic fieldwork coordinator can be a great resource for deciding, does that objective meet the criteria that they're looking for, and maybe how to tweak it a little bit so that it's a little clearer for the student in their understanding. You also want to talk to the academic institution because they all have their own curriculum design, and you want to make sure that your particular objectives match their curriculum design and to help enhance the student's learning. Other considerations that I would say are a little bit more specific to the occupational therapy assistant is there are some times when an occupational therapy assistant in some settings will not be expected to perform certain tasks. It may be due to the regulations of the facility, it may be due to insurance requirements, and there can be other reasons. If that's the case, the AOTA evaluation forms still do require students to be exposed to a number of skills, so sometimes you may have to create a mock experience in order to allow the occupational therapy assistant the opportunity to try these skills. You can also allow the student to follow other practitioners. Perhaps the student in your setting who's an occupational therapy assistant is not regularly required to complete certain steps of an evaluation or assessment. Well, allow them the opportunity to see the whole picture by following an occupational therapist and observing what that occupational therapist does. In the long run, that'll help that occupational therapy assistant have a much better understanding of what the evaluation results mean when they do finally get a chance to read them in the documentation as they're helping work towards treatment planning. Now, if you do have a facility that's reached out to you for level 1 objectives, you are going to want to talk to them and find out what exactly they're looking for. Again, each academic institution will have certain level 1 fieldwork requirements. It may match either the particular course the student is in that semester, or it may pair with the curriculum design and this particular rotation for level 1. Perhaps the student is getting exposed to evaluations, or perhaps they're getting exposed to managing groups and directing behavior. So you want to find out what the academic institution is looking for that level 1 experience. Once you get the objectives from the academic institution, review those, and then let the academic institution know which particular level 1 objectives your facility can provide. It's understood that not every clinical situation is going to be able to provide every level 1 fieldwork experience objective. But you want to make sure the institution that you're working with knows that, so that if it's a critical objective that they feel is important to be addressed, they will know whether or not they need to also look for some other experiences for that student. Then once you get those level 1 objectives, take them back, talk with your staff, and customize them a little bit. It can be really helpful to add a couple specific things for your institution. For example, if you are in pediatrics, being exposed to an assessment in pediatrics could look very different than the type of assessment you might be exposed to in a work hardening situation. So you want to take that level 1 objectives and customize them a little bit, but again, make sure you're collaborating with the academic institution where you're taking those student interns from. I hope that was really helpful in learning a little bit about how to set up level 2 and level 1 objectives and how important it is to collaborate with your academic institutions. Again, your academic fieldwork coordinators can be a great resource for getting more information and guiding you along in the process of setting up objectives. I hope to talk to you again.